We particularly specialise in seeing young people with OCD or related difficulties, which include problems such as body dysmorphic disorder or tic disorders, including Tourette syndrome. And we primarily offer assessment and treatment to young people with those difficulties. OCD can actually affect anyone, really. It is equally common across different social, cultural and ethnic groups, and we know that it's equally common in girls and boys and can start really at any age. It can be diagnosed in children as young as 5, although we do know that it becomes increasingly common during childhood later on and into teenage years. It probably affects 1 or 2 in every 100 young people below the age of 18, which means if you think about an average school with 1,000 students, there are probably around 10 to 20 young people with OCD in that school. Mildly obsessive behaviour turns into a disorder really when it crosses a boundary and is at a level that becomes particularly distressing or starts to interfere with day-to-day life. So a lot of people describe themselves as having OCD traits, and what they often mean by that is that they have a few habits or maybe routines that they like to carry out in a very particular way. So we might recognise that the habits or rituals had escalated to a level that we would call a disorder if, for example, they're getting in the way of family life or social functioning or school life. OCD is a disorder that can affect people in many, many different ways. Actually, it's highly variable, and I think that's one of the reasons that it can be difficult to recognise and diagnose. The most common symptoms in young people are a fear of contamination, a fear of dirt and germs, which often leads to excessive washing. And another very common presentation is a fear of being responsible for some kind of catastrophe, such as a fire or a flood, and that often goes hand in hand with excessive checking. There are a number of other common OCD symptoms that are less widely heard about. So, for example, we know that 1 in 4 young people will experience sexual obsessions, and these are actually recurrent, unwanted thoughts, often about an inappropriate sexual act, and they can be highly, highly distressing to the young person and often the family members around them as well. We have the privilege of really dedicating our work to OCD and some of the closely related disorders, which means that we develop a very in-depth knowledge of OCD and how it affects young people, the range of different presentations. We're able to offer very flexible treatment packages to young people at a range of different intensities, ranging from the standard package of weekly outpatient clinic appointments through to much more intensive, almost daily in some cases, home-based treatment sessions. So we're really able to tailor our treatment to the individual. If a parent is worried that their child might have OCD, then probably the first step is to access a little bit more information about the disorder, which there are various very useful resources and websites, including OCDYouth.info, our National Specialist OCD Clinic website, and also a number of UK-based charities. OCD Action and OCD UK have excellent resources available. The next step would be to go to their GP and to talk about the options that might be available. In the first instance, the GP might suggest referring the young person to their community child and adolescent mental health service, where they're able to access treatment. In the longer term, they may also consider a referral to a specialist clinic such as our OCD and related disorders clinic at the Maudsley Hospital, 70 or 80% of young people will respond to cognitive behaviour therapy with or without medication. But we also know that the majority of young people in the UK, unfortunately, are unable to access that treatment at the moment, and it isn't available to them. So one of our priorities is to think about how we can help disseminate treatment on make it more widely available for young people.